How intermittent fasting affects metabolism. The science explained. What happens inside your body when you stop eating? The answer is far more profound than most people realize. Within hours of your last meal, your metabolism undergoes a dramatic shift. Hormones change, cells activate ancient survival programs, and your body begins burning fuel in a fundamentally different way. Welcome to Medical Sciences Unfolded. Today we explore the metabolic science of intermittent fasting, what actually happens at the cellular and hormonal level, and what the evidence says about its health effects. First, let's define intermittent fasting. It is not a diet in the traditional sense. It does not specify what you eat, only when. The most studied protocols are 16-8, fasting 16 hours and eating within an 8-hour window, 5-2, eating normally 5 days and restricting calories to 500 on 2 non-consecutive days, and alternate day fasting. All of these protocols share the same fundamental mechanism. They extend the fasted state and trigger a metabolic switch. Here is what happens metabolically after your last meal. In the fed state, the first 4 to 6 hours, insulin is elevated. Glucose from your meal floods the bloodstream. Insulin signals cells to absorb glucose and store any excess as glycogen in the liver and muscle. Fat cells take up fatty acids and store triglycerides. Anabolic processes dominate: protein synthesis, cell growth, and energy storage. As you extend the fast to 8 to 12 hours, liver glycogen stores begin to deplete. Blood glucose drops gradually. Insulin falls. Glucagon rises. The liver shifts to glycogenolysis, breaking down stored glycogen to release glucose and maintain blood sugar. Fatty acids begin to mobilize from adipose tissue as the body transitions to fat as its primary fuel. Between 12 and 16 hours, the metabolic switch occurs. Liver glycogen is now substantially depleted. Insulin is at its lowest. The body enters a state of fat oxidation. Fatty acids flood into the liver and are converted to ketone bodies, beta-hydroxybutyrate and acetoacetate, by a process called ketogenesis. These ketones travel through the bloodstream and are used as fuel by the brain, heart, and muscles. This is the fasted state, and it is metabolically quite different from the fed state.
Beyond fuel switching, intermittent fasting activates a powerful cellular cleanup process called autophagy. The word means self-eating, and that is essentially what happens. Cells identify damaged organelles, misfolded proteins, and dysfunctional components and break them down for recycling. Autophagy is activated by nutrient deprivation and is suppressed by insulin. It peaks during extended fasting and is one of the most important anti-aging and disease prevention mechanisms known to science. The 2016 Nobel Prize in Physiology or Medicine was awarded for autophagy research. What are the hormonal changes of fasting? Insulin drops sharply, improving insulin sensitivity over time with repeated fasting. Growth hormone surges, particularly during sleep in the fasted state, promoting fat mobilization and lean muscle preservation. Norepinephrine rises, increasing metabolic rate slightly and mobilizing fat stores. Ghrelin, the hunger hormone, rises predictably but adapts over days to weeks of consistent fasting. What does the clinical evidence show? A landmark randomized controlled trial published in the New England Journal of Medicine in 2020 confirmed that time-restricted eating reduces body weight, improves blood pressure, and lowers insulin levels compared to unrestricted eating. Intermittent fasting has been shown to reduce fasting glucose and HbA1c in pre-diabetic and type 2 diabetic patients. It reduces LDL cholesterol, triglycerides, and inflammatory markers like CRP. Some studies show improvements in blood pressure independent of weight loss. In the brain, ketones provide a cleaner energy source than glucose, producing fewer reactive oxygen species. Emerging research suggests ketosis during fasting may improve cognitive clarity, protect against neurodegeneration, and reduce seizure frequency in epilepsy. Who should avoid intermittent fasting? Pregnant and breastfeeding women, children and adolescents, individuals with type 1 diabetes on insulin who risk dangerous hypoglycemia, those with a history of eating disorders, and anyone who is underweight or malnourished. The bottom line: intermittent fasting is not a fad. It is a metabolic intervention with measurable effects on insulin, fat oxidation, autophagy, and inflammation. When done correctly and with medical supervision for high-risk individuals, it represents one of the most evidence-based lifestyle interventions available. Thank you for watching Medical Sciences Unfolded.